Hello, my name is Tiffany Law. I am the program manager with the Inland Empire Community Health Initiative. We all kind of know how large the Inland Empire is, right? I think San Bernardino County alone is the size of 10 other US states. And adding on Riverside, we are just ginormous, right? So, a lot of the common challenges that the clients that we've worked with experience is one, just access to healthcare. So sometimes when specifically people live in these rural regions, whether it be Barstow or Blythe, Needles, the access to seeing a primary care doctor becomes a huge problem. And adding in a necessity for a specialty doctor even grows that, right? So whether it be OBGYN or dental services, sometimes it's really difficult for them to even access that healthcare. And that may be due to transportation, that may be due to just accessibility or long wait times, specifically in those areas, because they're operating with maybe one or two professionals to service a large community before they're even able to go to the doctor. It's trying to just get approved for Medi-Cal. So we know our partners at the county offices are backed up, right? They have their internal deadlines, but sometimes things can come up or paperwork can get misplaced or as we know with the internet, sometimes things say they're submitted, but they're not. And then you're trying to call county offices, and it can just become a large wait time issue while you're sitting on the phones waiting for someone to be able to pick up the phone and give you your answers, or you're waiting for weeks and weeks while you're in need of going to see a doctor for a specific purpose. So really, it's kind of a plethora of challenges that our clients, our patients, and our community members in general are facing. But specifically, like I said in our last example, inter-county transfers have become a really huge challenge. Like I said previously, we have so many people who are moving into Riverside and San Bernardino County throughout the next few years. I believe it'll be about 8 million people, that it's really difficult to educate the mass groups of people that are coming in that intercounty transfers are necessary, because they will essentially wait and wait and wait. And then as soon as it's time for a well visit, or as soon as it's time for their child's immunizations, they are trying to access the local doctor, but they need to have done the intercounty transfer already. So it's becoming an issue of access, becoming an issue of just general education, and becoming an issue of long wait times just to get approved for Medi-Cal. So, specifically around race and language, so California is one of the only states within the United States that offers Medicaid to everyone, regardless of immigration status. We have been finding that people are a little confused sometimes when they are trying to access this resource and they are not documented, because they believe that they can't acquire it, right? So we're trying to do a lot of education in that sphere of the fact that your documentation status does not impact your ability to gain healthcare, specifically in California, and then allowing other agencies to know that as well. So sometimes we have agencies who are referring people to us who they say, yeah, they're trying to find a doctor, but they don't really know who they can go to or if they qualify. And they're, again, afraid because of some of the federal mandates that are taking place around immigration, that they don't know or aren't sure if they can, or maybe are a little apprehensive of obtaining Medi-Cal. And so for us, they need to really think of the comfortability of the patients when they are referring them, because we are going to be there to support them and provide education, provide insight. And some of the subcontractors that we work with also provide access to immigration lawyer services for a discounted price. But it is really difficult to sometimes help people understand when it becomes their safety or the safety of their children or the safety of their entire family, that we are still there to help. They can still come in and receive services when we have so many other looming threats that are happening in the state of in our state, or really in the state of our federal government as well. I think a huge piece of this is when it comes to providing care for people who are immigrants or who are undocumented, to not see them as a monolith, right? When it comes to viewing or who the face of undocumented citizens are, we kind of have a very clear picture, and that leaves a lot of other cultures, a lot of other dialects, a lot of other just groups of people out of the conversation who also need to be brought in. So when it comes to providers within the field of health or health coverage, it's important to know that just because someone looks like they are documented does not mean that they are. And especially when it comes to providing information to people who may or may not be undocumented, it's so important to be aware of not only the different dialects that can come. So someone who is from Mexico may have a specific dialect, while someone from Honduras has a different one. Someone from Guatemala has a different one. So we need to be really mindful of these things and all of the little language differences that can make someone go in thinking maybe that this is a safe space and leave feeling that it's not, because you have referred to them outside of their actual nationality or assumed something of them. Same with within the IE, we have a large Vietnamese population, a large Korean population. So we really need to make sure that we're providing things in a multitude of different languages and not only English and Spanish. You want people to walk into spaces and feel like they are part of the discussion and part of the service population without having to feel like they need to wait for someone else to get there or have to piece things together. And this can be even in the hiring practices of medical offices, right? Or of clinics. So ensuring that your staff is representative of the populations that you are servicing.